Hi everyone. In this video, we'll quickly brush up on the action brought about by the muscles of mastication. I hope that by now you're well versed with the basic anatomy of the TMJ, but if not, I would strongly suggest that you read up about it or watch a video or two. I have a video about the TMJ, so feel free to check that out or watch any video that you like. So let's get started. The masticatory musculature is a group of muscles responsible for the movement of the mandible during the act of mastication or chewing of food. A few things to make sure we remember before we start. I know you guys must be knowing this already, but we'll discuss them anyway for the sake of better understanding. So, when we talk about muscles, we talk about their origin and insertion. Now, the bone where the muscle has its insertion is the bone that moves during the contraction of the muscle. So, the muscles of mastication have their origin at different places in the cranium and they insert onto the mandible to bring about the various mandibular movements. Secondly, a nice tip to remember the action brought about by a muscle is to see how its fibers are oriented. We'll see how in the next few minutes. It's also important to understand that the action of masticatory muscles, or any muscles for that matter, is highly regulated or controlled by the neural system and they function in a highly coordinated manner. So, for example, different parts of a muscle may contract at different times to bring about a movement, or when a muscle contracts, its antagonistic muscle has to release its contraction for the desired movement to occur. When we talk about the mandible, the mandibular movements that are brought about by the masticatory muscles include firstly elevation, which is an upward movement of the mandible or the closure of the mouth, depression, which is a downward movement of the mandible or the movement that occurs when during the opening of the mouth, protraction or protrusion, which is the forward movement of the mandible, retraction or retrusion, which is the backward movement of the mandible, and lateral or side to side movements, which are the principal movements that occur during the grinding of food. The act of mastication is majorly brought about by the four pairs of masticatory muscles, which are the temporalis, the masseter, the medial pterygoid, and the lateral pterygoid. The suprahyoid muscles, mainly the anterior belly of the digastric, the mylohyoid, and the geniohyoid, are more like accessory or secondary muscles of mastication, but they're nonetheless important. Let's first talk about the major muscles of mastication. Coming to the temporalis muscle, now, my drawings might not be the most anatomically accurate, but I just want to get the point across. They'll get better, I promise. Now, when we look at the temporalis muscle, we'll see that it is a fan-shaped muscle. It originates at the temporal fossa of the temporal bone and attaches onto or inserts onto the coronoid process of the mandible. The temporalis muscle has anterior, middle, and posterior fibers. Now, if we look at the orientation of the anterior and the middle fibers, we'll see that they are oriented more or less vertically or slightly obliquely. So, as the anterior and the middle fibers of the temporalis contract, they'll elevate the mandible, move the mandible in an upward direction, or close the mouth. Now, when we look at the orientation of the posterior fibers, we'll see that they are oriented a lot more obliquely and almost horizontally towards the posterior end. So when they contract, they'll pull the mandible backward or they'll retrude the mandible. Now I want you to place your hand on your temple and clench your teeth. You'll feel the temporalis muscle contracting. So the temporalis is active in clenching. The masseter, the name of the muscle itself means to chew. It's a pretty powerful muscle of mastication. Anyway, like you can see, it is kind of a rectangular shaped muscle. It has its origin on the zygomatic arch and inserts onto the angle and the ramus of the mandible on its lateral aspect. Now it has a superficial portion and a deep portion. If we look at the orientation of the muscle fibers of the superficial part, we'll see that they are kind of oriented in a downward and a backward fashion. and the muscle fibers of the deep portion are oriented more vertically. So as the muscle contracts, it pulls the mandible upward. So it results in an elevation of the mandible or closure of the mouth. It also causes a small amount of protraction of the mandible. Now, if you place your hand on the angle of your mandible or the angle of your jaw and clench your teeth, you will feel this muscle getting activated. So the masseter and the temporalis muscles both are active in clenching. Speaking of the medial pterygoid muscle, now it can get a bit confusing to remember the origin of this muscle mainly because of its name, but make sure you remember that the medial and the lateral pterygoid muscles both originate from the lateral pterygoid plate of the sphenoid bone. They are named this way because the medial pterygoid muscle originates from the medial aspect of the lateral pterygoid plate, and the lateral pterygoid muscle originates from the lateral aspect of the lateral pterygoid plate. Alright, so imagine that this were a view of the mandible from behind. These were the lateral pterygoid plates of the sphenoid bone. And like I said before, the medial pterygoid muscles originate from the medial aspect of the lateral pterygoid plate and from the palatine bone as well. And from there, the fibers kind of move in a downward, backward, and lateral fashion to attach onto the mandibular angle and ramus on the medial aspect. In the previous slide, we saw that the masseter also attaches onto the mandibular angle and ramus, but it attaches onto the lateral aspect of the mandible. So the medial pterygoid along with the masseter forms this nice muscular sling that supports and suspends the mandible and results in a very effective elevation of the mandible. Alright, coming back to the medial pterygoid muscle. Now, the mandibular movement that occurs because of the contraction of this muscle depends on if it's a bilateral or a unilateral contraction. Let's look at bilateral contraction first. Now, if the medial pterygoids of both the left and the right sides were to contract together, because of the orientation of these muscle fibers, this would result in a forward and upward movement of the mandible. So it's responsible for protraction and elevation of the mandible. Now, if only the medial pterygoids on the left side were to contract, for example, it would result in a medial movement of the left condyle. So this would result in the mandible moving to the right side. So unilateral contraction of the medial pterygoid moves the mandible to the contralateral side, or in this case to the right side. Next up is the lateral pterygoid muscle. Now this is a view of the mandible from the side, and this is a view of the mandible from behind, or a posterior view of the mandible. Now let me name a few structures to start off with. So this would be the lateral pterygoid plate of the sphenoid like we saw in the previous slide. This would be the mandibular condyle, obviously. Here is the articular eminence, and this would be the articular disc. Now the lateral pterygoid muscle has a superior head and an inferior head. Let's look at the inferior head first. So the inferior head originates on the lateral aspect of the lateral pterygoid plate of the sphenoid and inserts onto the neck of the condyle, on the pterygoid fovea to be more precise. So if we were to draw it on this diagram, imagine that here would be the lateral aspect of the lateral pterygoid plate. So the muscles would kind of run something like kind of like this over here and over here. It's not anatomically correct, I know, but just trying to make a point. So the insertion of the muscle is kind of backwards and lateral to its origin. Now, the action that is brought on by the inferior lateral pterygoid depends on if it's a unilateral contraction or a bilateral contraction. So let's look at bilateral contraction first. So a bilateral contraction of the inferior lateral pterygoid would cause the condyle to move forward. It will exert an anterior pull on the condyle. Now, the anatomy of the articular eminence is such that any anterior pull would result in a downward and forward movement of the condyle. So that would result in mandibular protraction and depression of the mandible. So the inferior lateral pterygoid is the only muscle amongst the four masticatory muscles to cause depression of the mandible or opening of the mouth. Now, what would happen if the muscle were to contract unilaterally? So for example, we had the left side
inferior lateral pterygoid contracting along with the medial pterygoid on the same side. Now, because of the way the fibers are oriented, contraction of these two muscles unilaterally would result in a medial shift of the left side condyle. So the mandible would move to the right. So contraction of the inferior lateral pterygoid and medial pterygoid on the left side would move the mandible to the right side. So this is called as contralateral excursion of the mandible. Alright, so moving on to the superior head of the lateral pterygoid muscle. Now the superior head is not really active during jaw depression, it's more active at the end of closure. So when we close our mouth, there has to be a structure that makes sure that the condyle disc assembly gets positioned correctly below the articular eminence. And that's exactly what the superior head of the lateral pterygoid muscle does. So because it's attached to both the disc and some part of the condyle as well, it makes sure that this assembly gets positioned properly below the articular eminence at the end of mouth closure. Now imagine that this were a view of the mandible from front and from below. So here we have the mandible, here we have the hyoid bone. The suprahyoid muscles, mainly the anterior belly of the digastric over here, the mylohyoid over here, and the geniohyoid muscle over here are more like accessory muscles that cause depression of the mandible along with the inferior lateral pterygoid muscle. So the movement that occurs because of the contraction depends on the state of contraction of other muscles. So for example, if the hyoid bone were to be held in place by the infrahyoid muscles, then the suprahyoid muscles would cause depression of the mandible along with the inferior lateral pterygoid muscle. Okay, it's time for a quick summary now. Let's categorize muscles by the movements that they are primarily responsible for. So firstly, jaw depression or mouth opening is a result of gravity, obviously, and bilateral contraction of depressor muscles, which are the inferior lateral pterygoid muscles, and the suprahyoids, mainly the anterior belly of the digastric, the mylohyoids, and the geniohyoids. Jaw elevation or mouth closure is the result of a bilateral contraction of the elevator muscles, which are the temporalis, the masseter, and the medial pterygoid muscles. Mandibular protrusion or protraction is brought on by the bilateral contraction of the inferior lateral pterygoid and the medial pterygoid majorly, and to a small extent by the masseter muscle as well, whereas retraction of the mandible is brought on by the temporalis muscle, and if we were to be more specific, by the posterior fibers of the temporalis. Lateral or side-to-side movements are brought on by the unilateral contraction of the inferior lateral pterygoid and the medial pterygoid. So let's revise this again. If these two muscles on the left side were to contract, the mandible would move to the right side. And if the muscles on the right side were to contract, the mandible would move to the left side. So this is what is called as contralateral excursion. Let's put together what we know thus far about the anatomy of the TMJ and the masticatory muscles, and just kind of picture in our heads what the sequence of events would be during mandibular opening and closure. So here we have the mandibular fossa and the articular eminence of the temporal bone. Here we have the upper joint cavity. Here we have the articular disc, the lower joint cavity or compartment, if you will, the mandibular condyle, the head of the mandibular condyle to be specific, the retrodiscal tissues. This here in red would be the superior head of the lateral pterygoid muscle, and this here in green would be the inferior head of the lateral pterygoid muscle. This here is the temporomandibular ligament, which we discussed is the anterolateral thickening of the joint capsule itself. Now, mouth opening is initiated by the depressor muscles and gravity, of course. The depressor muscles being the inferior lateral pterygoid muscles and the suprahyoid muscles, which contract bilaterally to initiate mouth opening. Now, what happens during the initial stage of mouth opening is that the condyles just rotate in position. They do not move forward. So this pure rotation of the condyle occurs in the lower joint compartment, and occurs until 15 to 20 millimeters of incisor separation or so. Now, after this amount of rotation, what happens is that the temporomandibular ligaments attain their maximum length, and so the condyles can't rotate anymore. So the condyle, along with the disc, doesn't have an option but to slide down the posterior slope of the articular eminence, slide downward and forward, and this kind of translational motion occurs in the upper joint compartment. Now this occurs until the mouth has opened to its maximum, which is about 50 to 60 millimeters of opening or incisor separation. Now when the mouth begins to close, it begins with the contraction of the elevator muscles of the jaw, which are the masseter, the temporalis, and the medial pterygoids bilaterally. So these muscles contract and initiate mouth closure. Now the retrodiscal tissues have kind of an elasticity to them. So they also kind of pull the condyle along with the disc backward during mouth closure. And during the final stages of mouth closure, the superior lateral pterygoids also become active to make sure that the condyle and the disc are stabilized or positioned correctly against the articular eminence. Now, mandibular movements are a lot more complicated than what it might seem like. It's important to understand that they are really highly controlled and regulated by the nervous system, and they also function in a highly coordinated manner.
All right, it's quiz time. I hope I was able to explain this topic well to you. Feel free to pause the video, give it a try, and let me know how it went. Find the answers in the description box. Thank you so much, guys, for staying with me till the end. As always, feel free to ask questions or post comments. And that's it. Take care, stay safe. Bye.